Hey y'all, it's Ellen with Hometown Health Clinic, and we are discussing our Healthy Neighbors, Healthy Community series. So today we have David Johnson. He is a counselor here at Hometown Health Clinic with us, and we're just going to chat about what he does and how we can help our community here with the services that we provide. David works down in our OBOT department, and David, what is OBOT?
OBOT is the title that the state has given to this particular program, and it stands for Office-Based Opiate Treatment.
Okay.
And so that means that if it's office-based, that means that you don't have to go somewhere else. It all happens in the office here.
It's not inpatient.
Correct.
It is here in our facility, down the hall. You come to your appointments, come to your counseling.
Do it all right here.
And then get to go home.
Yes, exactly.
Awesome.
Go back to your job, whatever you need to do.
What services do we provide with OBOT?
With OBOT, we have a team approach to that. We have, for instance, we have a social worker who checks to see if they're in need of food, or they in need of housing, or they're in need of help with other kinds of matters. And so he does those practical things. Then we have a nursing staff that attends to those kinds of medical needs. We have the medical provider who actually prescribes the medication. And then we have counselors also. So we look at trying to treat the whole person. That's what we try to do, which is what we try to do at Hometown anyway.
Okay. And with OBOT and those services, what medication are we using to help treat addiction?
Yeah, the medication is called Suboxone, which a lot of people still have never heard of it. It's just surprising, but it is a medication that works extremely well at managing the symptoms related to opiate addiction. And those symptoms are the cravings and the withdrawals when a person doesn't have the opiates.
So it works with opiates. Is there any other things that are out there right now that we can help?
Well, we've discovered that Kratom is the newest thing on the block, and it was, I don't know how many months ago that people started calling and asking about that. We had to educate ourselves about, well, what is Kratom, what does it do, and why are we trying to treat it? Can we treat it? Can we know what to do? And there's really no model that we could follow. It wasn't, we could say, well, what are you doing? We'll call other clinics, because nobody was doing anything with it. And our research shows that Kratom it's from a plant, okay? It grows in Southeast Asia, and it has opiate-like qualities. And so that means it can give you a little relief from your pain, and it can give you a little more energy.
Is it a safer alternative to opiates?
That's what everybody thought, especially because it's available on the counter. You just walk in, you can buy it anywhere you want to.
You can see it in the signs.
Yes, it's everywhere. But what happens is it has a very short-lived effectiveness. That is, a person has to take more. They can take some, and then 2 hours later they got to take some more. A few hours later, you got to take some more, and so and then it's got to take more and more and more and more, which is exactly what happens with opiates in general. That the longer you take it, the more you have to take. Then what people don't think about what's happening is that if they stop the Kratom, they're going to have horrible withdrawals, just like opiate withdrawals. Really sick, nauseous, body aches, diarrhea, leg cramps. It's awful. And so we found out that Suboxone does a really good job at helping manage most of those symptoms.
A lot of people I see state that Suboxone is just taking the place of. Can you help people understand the difference in replacing it with another drug per se?
Yeah.
And then how they wean off of it?
Yeah, I would love to, right? Because I hear that a lot. Well, they're just swapping one drug for another. Okay. A person does not become addicted to Suboxone. The definition of addiction is you want to take more and more and more and more. Well, people aren't out here on the streets in our program taking Suboxone. They're out here trying to find more they can buy so they can take 10, 11, 12 a day. That's not. Okay, so that's what an addiction is. I love what one of our patients said one time in a group setting. The group was talking about, well, people are saying to me I'm just swapping one drug for another, and just kind of trying to deal with that feedback. And this person who's been in our program for many years, she says, well, I used to argue with people about that. She said, but I'll tell you what I tell people now. I'll tell them, you are exactly right. I swapped all of those drugs for this one drug, and I swapped that life for this life, and I would do that any day of the week.
I love that.
Yeah, I do too.
I love that. You mentioned with that particular patient that they've been in the program for a long time. Is there a limit to what a patient can do in our program with OBOT?
There really isn't. We leave that up to the patient. We let them decide for themselves what they want to do. So some people they come in the program and they want to be in the program for only a matter of months if they want to. And then we have people who have been in the program for years. And periodically I might say to them, do you ever think about maybe you want to get off of the Suboxone? And it's almost a universal reaction when they throw up their hands and say, look, my life has never been this good for this long. I don't want to take any chances to mess it up. Well, I'm not going to arm wrestle somebody about that because it's working.
Wonderful. What are some misconceptions that people have about opiates and kratom and what it's doing to them?
I think the people that are connected to the people who've become addicted, they need to understand that when they say to them, well, just quit using it, just stop, okay? Well, that's really easy for you to say if you don't understand what's going on to the body, okay? Because opiate withdrawal, kratom withdrawal is not like withdrawal from any other kind of drug. A person can do meth and they can just quit, okay? They're going to be fine. They'll sleep for 4 or 5 days, but they'll be okay. Cocaine, same thing, okay? So none of these other drugs have these horrible physical withdrawals. It's like if you had the flu times 10. That's how severe it is. And that's why before Suboxone came on the scene, the success rate for people getting off of opiates was dismal, 10, 15%. They could go to detox and then get off of it, but then they're going to go right back to it.
Mm-hmm. What can we tell family and friends of those that are struggling with addiction? What words of encouragement do you have for them?
I would say to you that a person will only get help when they decide they want help. You cannot make a person get help. You can encourage them to. You can provide them with our phone number. You can let them know this. Here's an opportunity if you want to go get help. But I encourage people to learn how to separate themselves from the person's addiction and understand that the person has to own their addiction. And so it's just up to them. And I know that's frustrating. I've been in your shoes, actually, and I know how frustrating that can be because you just want to say, look, go get help. And they may say, yeah, I need to go get help. But it's kind of like people that need to quit smoking cigarettes, right? I'm going to quit one day. I mean, that's what they say, right? Well, can you make them do that? No, you can't do that. So be patient with that process. I'm a praying person. I would encourage you to pray for that person and ask God to just help turn their heart toward the right decision for themselves.
Wonderful. Well, we are going to wrap up our time with Mr. David here. Is there anything to add about our program or your experience with either one of opiates versus, kratom?
Let me say this. I'll say this to you, that we treat everybody with a high degree of respect. When you come into our program, we're not interested in shaming you or making you feel bad or talking about how awful you've been and all the awful things you've done. If you come to us and you want help, from the very first phone call you make, we're going to treat you with respect. We treat you with confidentiality. What happens in our hallway over there in our patient rooms, that's nobody else's business. And at least just come and have a conversation with us, okay? Call, make an appointment. You'll sit down with me or one of our other therapists, and we'll just talk about what's going on with you. And you can decide after we explain it to you whether you want to, get a part of our program or not. Just make the phone call.
The great thing about our opiate addiction program, OBOT, it has a private entrance at the end of our building. You don't walk straight in the front door. You can come in at your own leisure. A lot of people aren't down that specific hallway, and it's confidential. They've got their own little area. It's very nice. They get you called back in a timely manner, and they just love and want to offer our services to help you. And like he said, you've got to be willing, and your loved ones have to be willing. But our doors are always open. Come see us today and get the treatment that you need, or encourage your family members to do the same.